This is Buffalo State Data Talk, the podcast where we introduce you to how data is used and explore careers that involve data.
Hello and welcome back to another episode of Buffalo State Data Talk. I'm your host, Heather Campbell, and thank you for joining us for episode 19. Today, we'll be talking to Karen Hall, the Program Director of Population Health Collaborative, a regional health collaborative whose mission is to improve population health in Western New York by connecting diverse groups and aligning resources and expertise. Welcome to the show, Karen.
Hi, Heather. Thank you for having me. I'm very excited to be here.
Excellent. So could you start us off by telling us a little bit about Population Health Collaborative and what you do for the company?
Sure. So Population Health Collaborative. So I like to start off by telling people that we are a small public and population health agency. So we work with different organizations that work in the health and social sectors, but we also work with those non-traditional health organizations such as school districts and law enforcement and work sites and really any entity that has an interest in improving public health and population health. So under what's called a collective impact model, there's something called a backbone agency. And so I like to describe a backbone agency as like a conductor in an orchestra. So you have all of these different, instruments being played, and you've got groups of instruments, and then it all works together to perform this beautiful piece of music. And so that's kind of what a backbone agency does. It's the behind the scenes, works with all the different organizations to keep things moving forward and to manage and facilitate and coordinate all of the different efforts that are happening for some type of large health and or social issue that's going on in the community.
Excellent. And what do you specifically do for the company?
So I am the program director. So we primarily work with grants, and that would be state grants, federal grants. Sometimes we get grants from foundations. And so I am for the most part, the PI, the primary investigator for any of these grants. And the grants all, for the most part, have to do with chronic disease prevention. That's kind of our niche. So I manage all of the grants, and I, create the work plans, and I create the implementation models, and I do the evaluation and all of the reporting for the grant.
All right. So what does a typical day or a typical week look like for you for putting in all of those grants and managing all of that?
Right. So there really is no typical day because I do something different every single day. I'm constantly switching hats, from grant administrator to data collector to data analyzer to a strategic planner to being a broker, if you will, bringing two different organizations together for a program. So it's different every day. And so then within all of those different things that I do here, it's different because there's different issues. I can switch from chronic disease in terms of like obesity prevention to maternal and child health, to mental health and substance use issues, to healthcare reform, to anything that involves health, which is a very, very large umbrella. So it truly is different every day. So it keeps me on my toes.
Yeah, that's a wide variety of things. So I could definitely understand not having a typical day. How is your time split between working with a team and working independently? Yeah.
So internally first, we have a team. So I'm the program director, and I also have, maybe at any given time, 1, 2, 3, or 4 different coordinators that help me implement some of the, the work plan for any grant that we get, any kind of initiative or work that we're doing. We work very, very well together. We work collaboratively internally, and then externally, our main constituents are the organizations that are doing the work with the community. So we work to serve the organizations so that they can serve their populations better. So we have to work collaboratively. As the name suggests, population health collaborative, collaborative is just built into our mission, our vision, our values, our goals, objectives, everything that we do. We're not subject matter experts in anything. I'm not a subject matter expert in mental health, in maternal and child health, in Lyme disease, in whatever else happens to come up. So we need our partners to give us that particular expertise and tell us, the intricacies of how health issues and certain diseases are happening and what's happening within the communities. And so we go in there as the capacity builder for that.
And so I know that you do spend a lot of time working collaboratively, but how much of your time, like 50, 70, 80?
Yeah, that's a very good question. It's definitely not 50-50. I would say it's more than that, maybe a 60-40 or a 70-30, with collaborative being the heavier part. Independently, there are times when I am alone in my office thinking, working, planning, writing up strategic plans, analyzing, and you need quiet for that. You need quiet time to let your brain do its work, and you need a lot of brain power and not distraction. So there are times where I am hunkered down in my office, no distractions, and working independently and trying to, write up, analyze and write up evaluation results and writing up reports, let's say. So
you mentioned before that you do, data collection and data analysis. What kind of data are you working with?
Mm-hmm. So primarily, we will work with the data that is readily available for anyone. So some of the data sets that are available through the Centers for Disease Control website and the National Institutes of Health website. We also, in the city of Buffalo, there is some data sites that we use. There's also the New York State Prevention Agenda data website that we use. Now, a lot of times the problem with this particular data is that it's outdated. So we also work with HealthyLink, which is a local repository for clinic and healthcare data. And so if you've ever been to a doctor's office before and you sign a form that allows your data to be shared at an aggregate level, a de-identified data, they have the data from health insurance companies and from the larger healthcare systems. So they are a very close partner with us where we can get some more granular real-time data. We also collect data ourselves. We work with data that's already made for us, and we, work with our own data that we collect. It just depends on the project that we're doing, really.
And so once you have that data, or for example, the publicly available data, what do you do with it?
So for the most part, when we work with data that's available and we're looking at a broad scale, we try to get it down as granular as we can because we want to translate data into action. It's great to have a piece of paper that says 60% of this population is obese. Well, great. Then what are we going to do about it? So that really informs us at who we want to work with and what we want to do. And so are we getting the right population with the right effort? And the data will tell us that. And depending on what an organization is looking for, sometimes they're just looking for us to analyze some data and give them the data. And then they will then in turn create their own programs, which is fine. Sometimes we act as a consultant and will provide some evidence-based programming or evidence-based, efforts, initiatives, policies that we recommend that get done, based on the data that is available. One thing that I do want to note that is not available right now that we're trying to work on is what's called Social Determinants of Health data, which I'll talk a little bit more about later. But to give you a little preview, social determinants of health are those non-health factors that have a direct impact on an individual's health. And that is not being collected at the way that population health experts would like it to be collected. So that's kind of an ongoing battle right now. We can't exactly solve health-related issues without knowing what the root cause is. And so that's kind of where we're at in terms of public and population health right now regarding data.
It makes it really difficult to solve problems if you don't know what's causing them.
Exactly. Yeah.
So one of my last questions about data here is how do you share the results once you collect the data and you analyze it? What are you doing with those results?
We have, probably 300 plus different organizations in our network. So if we come across something that is interesting that our constituents need to know, we share that. And we share that, we have an interactive website through livewell, westernnewyork.org. And we share that information with our larger network. We also will create reports for, any of the state grants that we have. We have to write up reports. That is a requirement.
So what are the specific, softwares or technologies that you use when you're analyzing your data?
Mm-hmm. So it depends, again, on what is being asked for us to do. In terms of the community health assessments, that can really just be done through simple Google Analytics, Excel spreadsheets, and really what SurveyMonkey provides you. It can be that simple because that data is not being used for any, research purposes. That is for internal folks at the health department or the hospitals to look at and then make up their programming based on that. If we are asked to do something on a larger scale, we can, Excel's pretty good at providing different formulas and doing some analytics for you, but we also use SPSS here, and we don't go anything beyond an SPSS. So that's what I'm familiar with. That's what I learned when I was in school, and that's what I'm comfortable with. And so we use that data platform.
Excellent. So what is your favorite part of your position?
I would have to say that, going back to what I said before, that no 2 days are alike. I've learned so much about different health issues that I never thought of before. I mean, I've worked in corporate health. I worked for the American Cancer Society for 14 years before I came here. There's so much that I don't know about health. And since I've been here, the importance of social determinants has really, really blown up and has surpassed good old-fashioned population health efforts of getting people to eat right, exercise, and not smoke. And so that's kind of taken a secondary as to getting to those root causes. And so discovering that and realizing that if we are looking at those social issues, that in turn will then make people physically healthier.
That sounds excellent. And it sounds like you're really enjoying your position. So that sounds amazing.
I'm pretty lucky. Yeah, I am.
So you also just brought up the topic of social determinants of health. Mm-hmm. So I wanted to chat about that a little bit. So can you tell us what is social determinants of health and why is it important?
Right. So social determinants in a nutshell are those root causes that keep people from being healthy or keep people from living a solid quality of life, if you will. So those are things such as poverty, lack of education, lack of transportation, lack of food access, lack of a community where they feel that they can go outside and be active safely. So it's the community in which you live. And that has a direct impact on someone's physical health and, of course, mental health. So back when I was in school, in undergrad, which is 25 years ago, so I'm dating myself right now, but we didn't know that existed, or that was not considered to be a public health issue or even a population health issue. And I remember learning about, getting people to ways and how to get people to eat right, exercise, and not smoke, not drink, and go see their doctor, et cetera, et cetera, et cetera. And it seemed like it was just very simple to do, to tell people what to do. But if you can't keep your lights on, and if you don't have a car, and if you have to take 3 bus routes to get to a simple doctor's appointment, or even to just go for a 5-minute blood draw somewhere, or if if you're going to run out of food and you can't feed your children, you are not thinking about eating fruits and vegetables and making sure that you're getting 30 minutes of exercise every day. So that, and then that is obviously going to have an effect on your mental and emotional health. So we've kind of flipped that now. So if we look at those social determinants and we try to solve those social issues, which is extremely complex to do, which is why you have to implement a collective impact model where there are multiple agencies working for one common goal, you try to solve those social issues. And by solving those social issues, you're going to, trickling down to the individual level, help with their mental and emotional issues, which then in turn will help with those physical type issues. If you're looking at the makeup of someone's health and what goes into an individual's health, 40% of that is social determinants. That's the biggest piece, with 20% being healthcare, like the actual brick and mortar provider type healthcare. So you don't get healthy by being in a doctor's office. It's everything else that surrounds that. So shouldn't it make sense that in order to solve overall population health issues that we focus on those social determinants first? And so that's where we're making our efforts, we're putting our efforts into that now. And in order to do that, we need to have stronger data. We have all sorts of outcomes that tell us how overweight people are, or what is the rate of cancer, and what is the rate of people getting their mammograms, or, we have all of this data, but we don't know what's going into those who do not get their screenings for a mammogram, or why is it that folks are actually obese? What types of neighborhoods do they live in? Are they able to access fresh fruits and vegetables? And if they do have access to that, do they know what to do with it? So we need data that shows us that. And that's what we're working on now.
So if our listeners are interested in this topic, do you have any resources that you could suggest that they could check out?
Mm-hmm. So, the Centers for Disease Control, which is the CDC, if you just Google cdc.gov, that's a great resource that gives you anything and everything health related and lots of public and population health information. There's also the Institute for Healthcare Improvement, IHI is what it's called. And I believe it's ihi.org. That is also another fantastic website that gives you anything and everything public population health and a lot of social determinants of health information in there. And from there, you can get other resources as well. But those are the two big ones that come to mind that is a great starting point. Another really good starting point is the Rural Health Network. Don't let the name fool you. It's a lot about rural health and the issues that happen with rural health, but it gives a wonderful overview of public health, population health, and the SDOH issues.
Mm-hmm. Excellent. Well, I will link those in the description of the episode.
Thanks.
So I want to switch things up just a little bit now and talk about your career path.
Okay.
So you have a master's in healthcare administration and a doctorate of education in health policy. So how did you end up working with data and end up where you are now?
So basically back in undergrad, when I got my undergrad, and I have a degree in biology and in community health. Back then it was called community health. And, that was just part of the whole, curriculum for the program in community health. Yeah, introduced to data, how important data is, how data informs your work. So it's been an integral part of my academic career since I started. Moving on into health administration, the data changed a little bit because health administration was a little bit more about operations and running an organization, if you will. And that takes data. You need to learn about budgets. You need to learn about, really budgets, because without a budget, you have no programming. So you need to learn how to manage budgets and what all goes into keeping the lights on at any kind of organization. But we also, again, used data a lot to inform programming outside of that institution. When I moved on to work in health policy, data absolutely drives policy. Policy doesn't get written without the data to support it. So if you are looking to introduce a new piece of policy or update an outdated piece of policy, you need to have the data to show that. So you need to develop a really good, strong case. And so if that is done quantitatively or even qualitatively, then we need that in order to implement or update or enhance a policy to be current with the times that are matching now.
Do you have any tips on how students can network and build their connections? Mm-hmm. I know that's always something that's really important for professional development, is continuing to build your network of people. So do you have any tips for that?
I would recommend getting involved in clubs, organizations that you can join. And that is a great first step. When I was in undergrad, I think I belonged to the, there was a public Pennsylvania, I went to undergrad in Pennsylvania. It was a Pennsylvania Student Public Health Association. Mm-hmm. And I was part of that. I also, when I would come home on breaks, I reached out to our local hospital. Our local hospital had a community health program, and I offered up my volunteer services to just come in, shadow, do whatever it was that they wanted me to do as a volunteer, and they put me to work. So, I spent a lot of time inputting data, as a 20-year-old college student, just to get my foot in the door, just to see what it was like. And I ended up getting my first job from that. So I made that relationship. So call local agencies, organizations, whatever it is that you think you have an inkling of that you want to do, and just learn more about that organization. We take interns, but I also take volunteers, and I also meet with students all the time to talk about things that they can do. And I've found that 99% of the professionals will gladly open their doors to students and be like, come on in. What do you want to know? Hang out with me for a day or two, and we'll get this done.
I really love your advice. I think a lot of the time when people think of networking, they think of going into a room of people and shaking hands. But networking can be as simple as talking to your peers in a club at your school. Yes. And networking can be, volunteering for a company and meeting new people. I think those are excellent ideas. I love that. Yeah. Yeah. So before we let you go, is there anything else you'd like our listeners to know that we didn't get a chance to cover today?
I don't think so. I just want to put my email address out there, and that's khall, KHALL @phcwny.org. If anybody ever wants to just reach out and chat about anything, please drop me an email. I'd be happy to meet with you. If you're local, we'll grab coffee at one of our, millions of coffee shops that we have here, because we have a lot, or we'll set up a Zoom and we'll talk, and I'm always open to meeting some young folks and inspiring young minds.
Excellent. And we'll also put your email in the description of the episode.
Awesome.
So Karen, thank you so much for joining us today.
Thank you. This was a lot of fun. Thank you for having me.
And to all of our listeners, if you haven't already, check out all of our previous podcasts. They're available wherever you listen to podcasts. And for more information about starting your career as a data scientist or a data analyst, go to dataanalytics.buffalostate.edu. And don't forget to subscribe so that you get a notification each time we release a new episode of Buffalo State Data Talk.